And because my cancer was advanced and I had no family history, the cancer center, the Tahoe Forest Cancer Center where I was treated, Dr. Heifetz had opened a cancer center in Cedars-Sinai in Los Angeles. And when he and his wife retired, and his wife is also a doctor, she's a radiation oncologist, they wanted to create a state-of-the-art rural medical model for people to get cancer if you were living in Tahoe and not have to travel to Sacramento or Reno to get treatment. So in this really awesome hospital in the mountains in Truckee, California, they started a cancer center. And he would present cases to a tumor board. And so they were actually affiliated with the University of California, Davis, which is an NCI designated cancer center. And a doctor there, Helen Chu, said, we should run the BRCA test on her. It's strange that she's so young and it's so advanced. And so they did do that. And at that time, I think the test was about $3,000. It's about $200 now. But like I said, I had great insurance. I only had a $30 copay. And they ran the test and I was positive for the BRCA gene. So there were moments where I was like, did my implants cause my cancer? Is this what it's about? And then once I knew I had the genetic predisposition, it's the statistics for breast and ovarian cancer if you're BRCA1 or BRCA2, and now there's a lot of other mutations they've found since then, genetic mutations that lead to certain cancers. But that immediately brought me back to that ultrasound technician saying, you're ready when you're ready. And so the good news, even though it's started out as somewhat of a tragic story, had my cancer not been advanced, they never would have presented me to the tumor board. So I would have never known I had the gene, which changed the course of my treatment, but it also gave my sisters the opportunity to be tested. And 2 of my sisters were also positive for the gene. So it gave them the opportunity to do the prophylactic removal of their breasts and ovaries, which is the standard of care if you're positive. It's the same thing Angelina Jolie did, and Christina Applegate had huge family histories of breast cancer. And since they are Hollywood people and have a platform, they've been able to bring some more awareness to the situation. So it is good that I waited, because I think it potentially saved my sister's lives. And when I have some interviews, I always tell people that Dr. Helen Chu from UC Davis not only changed the course of my treatment, but possibly saved 2 of my sister's lives.